Welcome to E-Heza's dashboard demonstration. Our first dashboards were created to help health centers manage data reporting requirements for a large nutrition initiative called FBF, or Fortified Blended Food Ubudehi Initiative. These dashboards are now in the process of being tested with stakeholders and refined based upon feedback. During this video walkthrough, I will highlight the areas in which the changes are being planned. And please note that this demonstration is utilizing cloned data and altered patient names to avoid any sharing of actual individual health information. While the data on the dashboard currently reflects the FBF program, we will soon be able to filter by entire health center specific programs such as FBF, or PMTCT, and by village through the Community Health Worker Program. So now I'll begin by signing into the system. And here I can choose between any health center that I've been assigned to. If a health center is signing in, they can only choose the health center where they are assigned unless they have specific permissions. So here I'm going to sign into Ruley Health Center, and I'm going to notice that you can either go into clinical care, find a patient through the participant directory, look at the dashboards, or check the device status. And I just want to also point out that this can be switched from English to Kenya Rwanda, but we'll continue in the English version. So here we'll click on the dashboards. And this is the first page. You can see that the top panels were created to celebrate success by highlighting the percentage of children who have good nutrition, and by demonstrating the hard work of healthcare workers by highlighting the total number of encounters they have conducted in this calendar year. The first graph shows the total beneficiaries with malnutrition, which represents the prevalence of malnutrition in any particular month. The yellow line demonstrates moderate malnutrition, and the red is severe. And you can filter by stunting, underweight, wasting, or by MUAC, or middle upper arm circumference. You can also, in the second graph, see the incidence of malnutrition, which means the number of new cases that are diagnosed in that particular month. And you can again filter by stunting, underweight, wasting, or MUAC. And then if you go down to the bottom, it says review list of malnourished children. If we click here, you can see any child who has either had a missed visit or a measurement that was anything other than green in the past 3 months. This can be assessed in terms of stunting, underweight, wasting, or MUAC. To simplify this process further, we will be changing this so that missed visits will have its own area. And so missed visits will no longer show up on this screen. It will be focused primarily on the cases of malnutrition. And we can go back to the main screen. And here next you can see statistics for this month. If you click here, you will see all of the aggregated data that's required for data reporting for the FBF program. This was created in part as a transition tool while we were awaiting completion of our integration process with the Rwandan Ministry of Health database. Because this month is not yet completed, you'll see that there's not sufficient information here because many of the health assessments have not yet occurred. So we'll go to last month, and this will show all of the statistics for the last calendar month. And here you can see the total number of children with malnutrition, as well as the number of new cases and the change from the previous month. It also describes the number of new beneficiaries, graduated beneficiaries, and those children who have missed a session. If you click on missed session, you can have easy access to the children who have missed their visits, as well as the phone numbers, so that their families can be contacted to either schedule a follow-up or graduate them from the program in the system if they have graduated for some reason. Similarly, you could hit severe malnutrition. And currently, this takes you back to the long case management list that I showed you previously. But this is being refined so that when you hit on severe malnutrition, you will only get those children who are severely malnourished over the past 3 months, and you'll be able to filter again by stunting, underweight, wasting, or MUAC. Now, if we go back, you could do the same with moderate malnutrition. And again, this has to be modified still, but it's in the process of being modified to represent only the moderately malnourished children in this section. And if you go back, you can see the middle table. This demonstrates key indicators by age group. And if you scroll down, again, wanting to go into last month to be able to see the accurate information. You will see the family planning methods are broken down by the percentage use by women in the health center. In the updated version, the percentages will also be listed next to the method, so that health center staff will be able to very easily look at this and know exactly the types of methods that their patients are using. E-Heza's nutrition module is the first that has been developed by our team. We've also completed an antenatal care module, and we're in the process of completing our acute illness module. Each of these modules will also have associated dashboards and case management tools once they are completed. Thank you very much for listening.